Low testosterone is having a testosterone value between 300 to 1,000 nanograms per deciliter. This is usually accompanied with symptoms such as fatigue, loss of muscle, lack of erections, lack of morning erections, gain of fat, depression, loss of sleep, and also lack of bone mineral density. In general, we use a blood draw. This must be drawn before noon, as everybody's testosterone drops after 12. I like to usually have 1 to 2 blood draws, demonstrating a testosterone approximately of 300 nanograms per deciliter or less. This is also accompanied with symptoms, such as weight gain, fatigue, loss of muscle, gain of fat, and also depression and erectile dysfunction and lack of morning erections. Diet and exercise is key. Being able to control your diet with your carbohydrate and caloric intake is important. Doing low weights, high reps will increase muscle mass and also increase testosterone. Other treatment options include pills such as Jatenzo, which is an oral testosterone that must be taken 2 to 3 times a day, injection therapy, which can be modified to once to twice a week to even every other day. We can also switch to pellet therapy, where we insert pellets of testosterone underneath the skin near the buttocks that last 3 to 4 months. We can also switch to Natesto, a nasal inhaled testosterone that can be sniffed 2 to 3 times a day. There's also testosterone cream, which can be applied to the skin. Lastly, there are testosterone patches, which I do not recommend as they can fall off. We should discuss which testosterone therapy is right for you, as there are also adjuncts that we can use along with your testosterone replacement therapy to change how you look and feel.